Well, given that Travis County was the only big county in the state of Texas that didn't have a hospital district, you would have assumed it would be a piece of cake. But something called politics got into it, and questions concerning, do we want to create an entity that has taxing authority? That led to some problems.
And Elliott makes a good point that the idea that Travis County was the last of the large counties to have it is some evidence of how difficult it really was.
You had a city-run hospital for a long time, and which ultimately was leased out to Seton Hospital, but essentially the city taxpayers, which make up about 65% of the population of the county, were paying for it, and the 35% outside the city were not. And so there would be an inclination for those people not to want a hospital district because they would have to start paying what the city folks are paying. Of course, the benefit there for the city taxpayers is you could share the tax burden.
The way I would approach that is I think that there was a tipping point reached. But, and that tipping point was a large number of people from wearing a variety of stripes and advocacy groups and individuals that cared about health care in this community, and the real significant need to have a better mechanism was reaching a tipping point. But if I had to point to any one person that helped push, if it's teetering, if it's tipping, who pushed it over and helped get things rolling, I would say that Clark Heydrich probably played one of the biggest roles in that regard. He came with a large amount of credibility. He wasn't seen as some, dare I say, pointy-headed liberal that just wanted to provide health care for everybody.
Why are you looking at me?
and so I think that made a difference. Although I would also say with some level of knowledge about it that Judge Herman was also a key instigator in that. Many of us may have been playing some role, but there were, I say those two people probably were the most influential in tipping it over and getting things rolling.
I would say that Kirk Watson as mayor was instrumental, along with Pat Hayes. And then Judge Herman came along and said, let's move this, let's stop studying, let's make it Travis County, we'll deal with a regional approach later. And then, of course, Clark Heydrich and Lowell Leberman.
It's an issue of tax equity. The needs that we have with regard to health care in this community sometimes get lost, but they're very real needs, and they require money to solve. While we live in a relatively wealthy part of the state, 25% of the population of this region is uninsured. So there's a real issue when it comes to health care, and when we talk about the taxes that went along with this, frankly, it made it a more equitable mechanism for how it is that we're going to provide, how we're going to collect resources so that we can provide services. And overall, it will save the taxpayer money.
My approach was I knew what the law was in order to force the issue on the table, and that was you could get 100 citizens to sign a petition to have an election for it. And I met with the Gray Panthers and some other health advocacy groups who were wondering why we didn't have a hospital district, and I said, well, nobody has called an election on one, and they kept thinking the city had a duty to do that. And I informed them, no, the county commissioners do, and the commissioners hadn't called one, and they said, well, how can we get them to? Can we go lobby them? I said, no, that's not going to work. They could have done this for the last 20 years. What needs to be done is to get a petition. And the Gray Panthers and others, Charlotte Flynn, said, well, I can get you 100 signatures. I said, good, we'll start. And we got 100 signatures real quick. Early on, I started looking for somebody that would be conservative yet reputable to carry the ball on the district. And I started poking around and realized that Clark Heydrich would be the right person. Then when his name came up, I was happy and pleased as punch with Clark. It passes with over 60%, and it clearly, even the most conservative districts in Austin, voting districts, voted in the 65% range for the hospital district. In the liberal districts, it was 80 and 90. And then even outside the city, in places like Old Westlake, we were right close to 50% for the hospital district. As you went further away from the core of the city, in the county, you started losing. But we got 30% in many places that people said we wouldn't get 10%. So people in the county stood up and said, yes, this is something we need to do to take care of people, and we need to have equity.
I think the citizens of Travis County who put their faith in this new healthcare district, and I think they feel and should feel well rewarded. I think the staff, the professional staff that you have in the healthcare district has done a really remarkable job of the startup. But I also think that we ought to tip our hat to the board and new board members that have come on. You know, this is one of those situations where becoming a new board member of a new healthcare district, when clearly people are going to be paying great attention to how things play out, may not be the most rewarding job you could ask to get. But we ended up with a first-rate first board and the subsequent members. So that's why I think they're doing very well.